Hi, everyone. Welcome to CommLead Connects. My name is Alex Stonehill. I'm the head of creative strategy for the Communication Leadership Master's Program. Welcome to those of you who joined us yesterday. Welcome back. And also welcome to anybody who's starting fresh with us today. This is CommLead Connects. It's our program's premier public event. This is our 6th year holding CommLead Connects, bringing together communication professionals, advocates, and our graduate students for conversations around a pressing issue of global consequence that we choose each year based on what's going on in the world. And this year's topic is listening and leading for health and well-being. So yesterday, today, and tomorrow, we've been talking about the role communications and communicators like us can play in advancing health and well-being, including in the midst of a crisis like the pandemic. Quick reminder that this session is being recorded for posterity. You may want to go back and look at the recordings for your own notes. So you should have gotten a notification as you came in about the recording going on. A little bit about our program as we're welcoming new people in. Communication Leadership is the University of Washington master's program that specializes in storytelling, communication, and ethical, impactful community building practices. We're celebrating our 20th year this year. And now welcome over 100 students representing nearly 20 different countries in our student body, and all of those are folks looking to advance their careers as communication professionals. My name is Alex Stonehill. As I said, I'm the head of creative strategy for communication leadership. My work in the program is to develop applied learning opportunities for our graduate students. And I've spent the pandemic working closely with student teams on public health campaigns with partners like the Department of Health and others, including in collaboration with some of our panelists today. For me personally, that work's been a great source of meaning during the pandemic and has given me a lot of hope that the tools of communication leadership have potential to alleviate crises and to bring us together as people. Many of you met Akin yesterday or have otherwise, but I want to give her the opportunity to reintroduce herself as well.
Hi, everyone. I'm Akin Yeshin. I'm the director of the Communication Leadership Master's Program, and I'm thrilled to be with you today. I am, as we were discussing topics to pick for this year, of course, based on our experiences each year at this public learning event, we try to touch upon and create a public learning space for professionals, for our students and alumni to explore a topic that is emerging that we should all consider at our places of work. This is our chance to make impact in future practice. And of course, talking and thinking about listening and leading for well-being and health has been on the top of everyone's mind. I personally have been thinking a lot about how we've been all lacking a guidebook or preparation for this moment when we when we got into it, and how wonderful it would be for us to, moving forward, have work and thinking done around how to proceed and how to communicate and lead if we have future crises after this moment as well. So we're hoping that this session will allow us to create some space to craft future practice at our organizations, wherever that may be. We're seeing in the chat that many of you are from all around the world. I just want to encourage you all to introduce yourselves in the chat by sharing with us where you work, who you are, organizations you're involved with, where you are in the world, as well as we have a brief chat prompt where we ask you to share with us one word that describes the communication or leadership practices of your organizations during the pandemic. Again, I know one word will be a difficult task, but we encourage you all to also share with us that so that we can have that. Just as a reminder, this event is being live captioned. So we have live captioners sharing it. So you can see the captions and they'll be representing what we're saying. And I also want to briefly mention our badge opportunity today. As we mentioned in preparation for this event, all of you who are participating today and also review and have participated yesterday, upon a submission of a reflection, will be able to receive a UW branded badge that reflects your participation on wellness and health communication that you can share on your LinkedIn profiles, as well as any type of professional representation you have. Let it be your resumes or your CVs. You're seeing what the badge will look like. We'll send after the event detailed instructions about how to submit your reflection. And upon, again, submission, you're going to receive a link as to link with the badge so that you can share it on your profiles. I want to thank you all for creating time for this very important work and for this very important topic. And I'll turn it over to Alex to start our session.
Yeah, I'm excited to talk about our focus today, which is communication and leadership in a health crisis. And before we dive into the specifics of the program, I did want to acknowledge that we are waking up, many of us, to news of a very acute geopolitical crisis this morning in Ukraine. And, I don't want to downplay its importance, but also recognize that it might be affecting some of our collective moods today. I even saw some tweets from some of our panelists talking about that. So I'm hopeful that our learnings today can be informative to handling not just the pandemic or other public health crises, but the multiple overlapping crises that have come to impact us collectively. It almost feels like every day or every month we're facing a new one, and they all impact us individually to different degrees. So I wanted to hold a little bit of space for that. With that said, our learning goal for today is to look at the leadership and communication lessons of the pandemic as they apply to different realms, from storytelling to organizations to public interest communication, and even interpersonally. And we have a wonderful lineup of speakers. As the speakers are speaking, we encourage you to share questions and reactions in the chat. The speakers won't be necessarily monitoring that in real time, but we will draw from the chat to ask follow-up questions for each speaker, or to guide the conversation in our recap question session at the end. So with that, I'm excited to introduce our first speaker, who is Gabriel Spitzer. Gabriel's a seasoned journalist who created the podcast Transmission about life at the heart of the pandemic for the public radio station KNKX. Gabriel, you and I interacted several years ago when I was on the news roundup for the sound effects show that you produced at KNKX. So it's great to be on the other side of the desk this time, as it were, hearing from you. So yeah, our hope today was to uncover your insights about how the pandemic has transformed the ways we communicate and tell stories, and what better way to do that than for you to tell us a little bit of a story about your work during that pandemic.
Awesome. Thank you so much. First of all, just thanks a ton to Alex and Akin and your whole team for setting up such a thoughtful space for these conversations. What a cool collection of people that you guys have assembled. Thank you. So my name's Gabriel Spitzer. I use he, him pronouns. These days I am on the communications team at Public Health Seattle and King County, working on COVID stuff, among other things. And my background is in journalism, specifically public radio journalism. So I'm going to give you like the first 20 years of my career in 30 seconds or so. Let's see here. My first real job in journalism was up in Alaska, in Anchorage, Alaska, working for the Alaska Public Radio Network. It was a ton of fun, an incredible place to be a reporter and to learn how to tell stories. Covered climate change and the Iditarod Trail sled dog race, and all kinds of issues in Indigenous communities. It was just an incredible experience. From there, I went on to WBEZ in Chicago, where I wore a whole bunch of different hats, had various roles, and eventually would go on to create a podcast in the early 2000s called Clever Apes, which was like a science and health podcast, all about people in the Chicago area and the just curiosity that underlies scientific inquiry. Perhaps some of the most fun I've ever had in my career professionally. And in 2012, I came to Seattle to work at what was then called KPLU, and is now KNKX. And again, the changing of hats began very quickly. I started out covering education, went on to cover science and health, and then would go on to create the show and podcast that Alex mentioned a little bit earlier, Sound Effect. So I'm gonna attempt to, I'm like the worst PowerPoint creator. I mean, I'm an audio person. So anyway, so I'm gonna attempt to share my slides, and I'm gonna hope that, that you can put up with it. So let's see here. All right, hopefully you can see my screen now. Alex, could you give me a thumbs up if it's, yeah, okay.
Yep, we can see and hear you great. And
oh, beautiful. And you know what? I just realized I forgot one step, sorry. Okay. So, so in 2015, we had this opportunity to create a show in a local show on the weekends in a space we never had something locally produced before. So we got to kind of have this playground, this sandbox to play in. And what we did was we created this show called Sound Effect. It was a weekly show that was all about sort of character-driven stories that shed light on larger truths and, hopefully illuminate something about what it is to live in this time and place, and to get it like what our region is all about, that kind of Northwestiness vibe. We did something like 200 episodes. Each one had a theme. We had fun with, this is our little team here, as you can see. And we were just making this show year after year and told all kinds of just fascinating and memorable stories. And it sort of brought us up to early 2020, and the last day of February, when we got a notification that there was a press conference being called at the Chinook building downtown Seattle from the Public Health Department and King County Executive Doug Constantine and others. And we showed up there and found that, that was the announcement of the very first coronavirus death known in the United States, the first outbreak. And if you can kind of put yourself back in that time a little bit, it was somewhat terrifying. I mean, this was when the life care outbreak was happening in Kirkland. People were being hospitalized and dying every day. And it became very clear that this was something that affects all of us. And so after that, I covered the story, I covered the news, and went about that week sort of trying to like going back to work, right? So going back to work, but thinking there's this seismic thing that's happening in the background, and what should we do about it? What's our responsibility to our listeners, to our community? What's our responsibility as journalists and storytellers? And it just didn't seem like there was something that we could just pretend was a big story rather than the story. You know what I mean? So I had this idea, and the week after that press conference, on about, I think it was Friday, I approached my boss and I said, "Hey, maybe we should like hit the brakes on this long-running, award-winning show that we have, and instead do something totally new. Let's do a podcast about life at the heart of the epidemic, because at that time we were the first in the country, and it felt like our story to tell, and it felt like something that everybody else in the country was going to be confronting soon enough. So if we could get across a little bit of both how to be safe and healthy, but also what it's like, that would be a service to the rest of the country. So somehow my bosses went for it, and we had to like come up with a name for the thing, and it's really hard to actually name a podcast, and these are all these terrible names that we came up with. I'm so glad that we didn't use any of them. Maybe that last one would have been okay. But we wound up with Transmission, this podcast that launched, I don't know, let's see here, it was March 12th or something like that. So less than 2 weeks after that first death was announced. So we were moving really, really fast. And our thought was to try and take the storytelling tools that we had developed on Sound Effect and bring them to bear in this emergency. So that means finding characters, uncovering narrative, speaking conversationally as if we're talking to our friends, neighbors, and coworkers, and processing what was going on together. So rather than kind of handing down knowledge, we really felt like it was like, this is a space for our community to kind of like work through this stuff. And so for the first episode, we had this, again, time travel here. This was a time when flattening the curve actually required a, explanation. And this seemed like the most important message during those first weeks to get across. And I had seen this this graphic here that seemed like a very simple and straightforward way to get it across. But I was like, how can we do this in audio? Like, how can we get across this picture in audio besides saying there's a long, skinny hill and then a tall, skinny hill and then a short, long, fat hill and so on. So we brainstormed about how to communicate this important concept. And so here's what we wound up doing. And I'm going to play a little bit of an audio clip for you. It's just about a minute and a half long. We went and spoke with Professor Carl Bergstrom at the University of Washington, who I bet a lot of you know, and I think some of you work with. He's the author of Calling Bullshit and is an infectious disease specialist and evolutionary biologist. So we talked to Carl, and then we had another source, another scientist at UW, whose name is Judy Tweet, a climate scientist, who has done this work before with climate data, where she sonifies it, where she like converts the data into sound as a way to kind of communicate another level of meaning to this data. So we got her help, and I'm just going to play a little bit of what that wound up sounded like here in episode 1.
It sounds like there's a pretty remarkable natural experiment that goes back about 100 years, and I'm wondering if you can tell us about it.
Yeah, there was a remarkable example of this that took place during the 1917-1918 Spanish flu. So we can see this example in the differences in the way that Philadelphia and St. Louis chose to respond.
We got a little help here. Judy Tweet, a climate scientist at UW, sonified this data for us. She made sound out of the actual numbers of excess flu deaths over time in each city.
And so St. Louis responded quickly and aggressively by shutting down public events and doing all the right social distancing and so forth. And they saw a relatively longer duration of the pandemic, but much, much lower numbers of cases. Philadelphia waited 2 weeks after it was circulating in the community, and they didn't do anything. They went ahead and held a great big parade before they started to implement these control measures. And what you saw there was this high, sharp hill where you get a rapid and really dramatic rise in the number of excess deaths.
So which are we going to be, St. Louis or Philadelphia?
I mean, that's the key question, right? Is we hopefully still have time to make that choice.
So that's just a little flavor of how we kind of tried to problem solve these things about like, okay, these are challenging concepts. These are mathematical concepts. How do we get these across in a conversational way and in a way that would make sense if we were like sitting at a bar and explaining it to a relatively bright and not that inebriated stranger. Yeah, so that's sort of the where we landed here in this first episode. And we also mixed in a lot of other elements about what was just going on at the time, talking about schools closing and about what people were thinking as they were walking around downtown, the few of them, and so on. And yeah, so this was, I feel like, we're about like 2 or 3 weeks ahead of the sort of general media zeitgeist around understanding like what flattening the curve was and stuff like that. And I feel like we kind of kept that pace up for the next few months. Seattle was hit first, and we kept saying like, oh, this is really new and important, and we would do something on it. And then, a week or two later, it felt like everybody was talking about it. So it felt like we were staying just ahead of what the story was developing. We tried all kinds of different ways of aspects of covering the pandemic, everything from embedding in communities of people experiencing homelessness to understand what that was like for them, talking with providers who work with people with intellectual and developmental disabilities about how they were weathering the isolation in the pandemic, talking about the demographic trends that were emerging and how pre-existing racial disparities in healthcare and in health were impacting the outcomes from the virus too. So a whole series of everything from, science to individual personal stories to following somebody who got out of prison during the pandemic, during lockdown. So, out of lockup into lockdown. One of my favorite episodes, I just want to take a moment to dwell on, is this one here. This was episode 8. The Virus Eye View. This was my attempt to sort of like do a microbiology lesson for the world. I found that, at this point, this was probably early April. that I still didn't completely understand how the virus worked, like what the steps were, what's the TikTok of how the virus actually does its thing. And so I was really curious about it. And also, I think, deeply unsettled on some level by what a virus is. And so I decided to create this story where we imagined basically like a movie shot from the point of view of the virus infecting somebody. So I'm going to play two little itty bitty pieces of that. So, just to catch you up on the movie, we start out, two people are standing there and one of them coughs and their respiratory droplet arcs through the air and lands in the other person's mouth. And, gross, right? But that is what sort of triggers this chain of events that then we track through the story. So here's a minute and a half or so of that.
So those spike proteins lock on to an ACE2 molecule on the cell.
And each of those spike proteins has 3 grabbers on the end, and each one is able to grab ACE2 receptor. They signal to the cell.
And then there's typically a trigger. So some form of event that allows the spike protein to rearrange.
Sort of get itself through the cell membrane.
And that's the kiss of death for the cell.
And now the virus is inside the cell. And this is where bad stuff starts to happen.
The person we're inside right now has no idea what's going on. They're going to the grocery store and watching Netflix and doing Zoom calls. But inside, this is that key moment when the virus reanimates.
And then it starts making all the different, kind of evil proteins it makes to replicate itself. Once those proteins are made, it sort of takes over the whole cell, shuts down what the cell's normally doing, and turns it into a virus factory.
And here's how that works. The virus.
Dang. Okay. Well, that's okay. You got the point. So as you can hear, it kind of turns into a horror movie about halfway through. And to me, that kind of captured both, I don't know, the practical mechanics of how this works, and also, at least for me personally, what bugs me about these viruses so much. Besides the suffering and death that they cause, it's just the fact that they're not really alive. Sort of, they're not quite a thing. They're not quite a being. They're weirdly mechanistic and Terminator-like as once they get into your cells. So anyway, that sort of informed, I think, the vibe of this story, and hopefully made it more than just a biology lesson. I'm going to play just one very, very brief bit from the end of this story, 30 seconds or so.
And as it leaves, the new virus pulls one more cold-blooded trick.
So the virus, on its way out from a cell after going through its life cycle, steals a bit of the host plasma membrane and basically wraps itself in that, cloaks itself, because it does not want the immune system to recognize it as a foreign entity.
Just sounds dastardly somehow, like they just are dressing up in the skin of their victims. I go to dark places.
Anyway, so besides being, nerdy and informative or whatever, which was what I was trying to make it, there's a couple of other reasons I felt like this was a story that I wanted to tell at this time. First of all, it was a time when we were still really obsessing about disinfecting surfaces and hand washing, and we were closing all of our public drinking fountains and outdoor playgrounds and stuff like that. So the point was that there wasn't a great understanding of how the actual transmission works. And I felt like this, even though it sort of feels remote from somebody's actual day-to-day life, this might give people actionable information to understand what is risky and what's not, understanding how it passes from person to person, and so on. So it felt like a good time for that conversation. And then it was also, we don't get to this, I don't get to this in the clips, but it was really also a story about the value of basic research, because one of those interviews in the story, Lexi Walls works at the David Wiesler lab, at the University of Washington, which was one of the really pioneering labs in understanding the spike protein well before SARS-CoV-19, arrived. even with its relative coronaviruses and stuff like that. And so the value of that basic research was also kind of I think one of the points of this story. So all of our stories, I hope, try and get across multiple things. So we worked on transmission up through July, August of 2020. And at that point, I made a transition. I left KNKX and I joined Public Health Seattle in King County. And some of the things that I was were in my head as I was managing that transition. Sorry. First of all, I was ready for something new. You got the B word, burnout. I think all of us have had points in the pandemic where we have just been ready to kind of like throw down our tools and go do something else. Well, I was sort of feeling that way. It was also things had changed, by then, in that it was no longer our story only, right? It was obviously a world story. And it felt like that we had kind of met a need when the time was right, and I felt like that need had changed. The kind of coverage, storytelling, and communications that we needed around the pandemic were starting to be different. And so I was ready for something new, and I was also eager to tackle, I think, some of these issues more directly. Journalism is a deep love and passion of mine, but it also sometimes can feel very indirect and hard to measure the impacts of. So I was drawn to this opportunity at Public Health Seattle in King County. I joined the communications team in August of 2020, right in the thick of the pandemic. And a couple of things just to tell about that, and I know that our time is running short, but one of the interesting things there is just that the communications shop is not at all separate from the rest of the response. We're like woven into everything. So, in all the meetings with the epidemiologists and the food inspectors and the homeless outreach teams and the vaccination and immunizations teams and all the people who are trying to mitigate the economic and social harms that come from from lockdowns and the prevention measures and so on. So every piece of that has some kind of communications mission, and so our team gets tapped for all these different things. And one thing I just want to highlight is it's also given me a really new and clearer lens, I think, on equity and collaboration around storytelling, particularly when you are trying to tell stories about and to groups that have been traditionally marginalized. So one of the things that we did was experimented with a co-creation model on our blog. We have this Public Health Insider blog, and a lot of it is places for general information. I published a piece yesterday about like data, but this was a series where we were highlighting something called PARCAD, which is the Pandemic and Racism Community Advisory Group. It's a community advisory board that was created early on in the pandemic, made up of community-based organizations, partners, nonprofits, people who are doing work in all these different communities, particularly BIPOC communities, and bringing them together. It started out as sort of like a way to disseminate information out from public health, and then it very quickly became a way to collect information in from the community. And then this third and current stage is actually about sharing power and having these community organizations and these community members play a role in setting policy. And so as part of that power sharing, we decided to do this co-creation content series where members of the comms team, like me, work with individual partners who sit on PARCAG. And in my case, it was the Rainier Valley Midwives, who are these incredible group of women in South Seattle who have just done amazing work around birthing and child rearing in all the communities in their area. And so I worked with them. We co-wrote this piece, and it was interesting and really difficult in the sense that it was just like awkward, but they were such great partners that it was very eye-opening as we went on, and understanding how language sends subtle signals, I think, and just understanding a little bit more about, you collaborate with editors as a journalist, but you're not usually collaborating with writers. So anyway, it was really fascinating, and it has, I think, informed the way that I write about these topics, even when I'm not working directly with another partner like this. Anyway, so as you see, I've worn many hats. I continue to change hats quite frequently, but I really am fascinated with and passionate about communicating about health and science. And I am constantly learning, and I look forward to learning more from my fellow panelists. So with that, I'm gonna just stop sharing.
Yeah,
And
thank you, Gabriel.
very much welcome any questions, and or I'll also shut up so we can move on.
No, I appreciate that everything that you shared, and it really strikes me that in our program we talk a lot about storytelling, and definitely I think one of the up top you talked about the contrast between processing information and processing like the feelings around what's happening to us when something happens like the pandemic versus just like disseminating knowledge. And I know that public health communication is often thought of, especially when you're working with a department like Public Health Seattle King County, probably initially a lot of it felt like we need to tell people what they need to know, but nothing more. Give them exactly the solutions or the behaviors that we want them to take on. But it does strike me as you're talking like how important it is to put that in the form of a story, and that they're going to be able to relate to, whether it's the story of the experience of somebody else in their community, or whether it's the story of the virus itself infecting somebody's body. So I'm really appreciative of your personification. Really quickly, is there anything else you'd like to share about that that contrast and how you've carried that over to your work at the Public Health Authority?
I think just an audience focus has been kind of what I've tried to bring to bear at public health. I think public health is always interested in the audience it reaches, right? Because there are usually actions that they want people to take or behaviors that they want to affect. But thinking of the audience, the reader, listener, viewer as an individual is a sensibility that I try to bring to it. So that might be things like acknowledging when something has changed, or something is confusing, or something is frustrating. I think there's a tendency like, oh, we don't want to sort of like heat this as something that is that's negative. But to me, it's so important to just say, mask, you guys. I know it's so confusing. First we said no, then we said yes, then we said some people could take them off, and so on. But it's changed because our knowledge has changed, and here's what we know now. So those kinds of connections, I think, are really important in order to make the really hard information resonate with people.
Yeah, and some of our comments in the chat are talking about authenticity, and I think part of that is having a little bit of vulnerability to say, we're a fallible body. We're going to tell you the best that we know, but sometimes that is going to change, and our knowledge is going to change. And the way that you pulled back the curtain, also in some of the transmission stories that you shared with us around, what do we actually know? How does this actually work on a scientific level? It seems like that is a great way to get people on the same page and get people on board with the sometimes difficult behaviors that they might need to take on or change. So thank you, Gabriel. I think that's a great transition to our next speaker, in terms of, how do we communicate to our constituents, sometimes in society as a whole and sometimes inside of an organization. Our next speaker is Carla Acosta Sandeen, who's the Chief of External Affairs for PATH, which is a global nonprofit dedicated to health equity. PATH has been working for 40 years to develop and scale up innovative solutions to the world's most pressing health challenges. And before Carla joined PATH, she has a broad experience in communication and in global health, and in communication in the global health and humanitarian sectors, including at the International Rescue Committee. So Carla, the question that we've posed to you today is basically just to share your insights into the best practices for organizational leadership during a health crisis. So I'm sure some of that touches on some of the things that Gabriel was talking about as well. Would you care to take over?
Yeah, thanks so much, Alex, and
Yeah.
thanks again. Thanks for having me. I have no slides, so I'm just going to share some remarks around this question of organizational leadership through a health crisis. And I think, as you said at the very top, Alex, I'm framing this also less about sort of COVID specifically. I think also just to say, Gabriel, that was really great and a bit of a time machine there to 2 years ago exactly right now, and some very similar shared experiences that we were going through. But so for my part today, what I thought I would talk about is COVID is by far the first, and it's not the only health crisis that organizations have to navigate and that leaders need to be well equipped to lead our people through. And so I'm going to lift up just a little bit and talk more about public health generally. And I know my fellow panelists are really focused on the communications, and I'm going to leave that in their hands and talk a little bit more about some principles of public health that I think go a long way in shaping our comms. So I'll dive in then. In Audre Lorde's essay, The Cancer Journals, one of the things she talks about is how in her experience having breast cancer, she felt gaslit and guilted, because she said that everywhere she turned, she felt like she was being told to look on the bright side of things. She says that repeatedly in the essay. And she says, you know, what she wasn't feeling heard, she wasn't feeling validated, and she certainly wasn't feeling equipped with the resources and the tools to better understand her health, her body, her changing body, her new reality, and tools to take care of herself and to be healthy. And she says in the book, I'm going to read a quote. She says, like superficial spirituality, looking on the bright side of things is a euphemism used for obscuring certain realities of life, the open consideration of which might prove threatening or dangerous to the status quo. And a bit later in the book, she says, it is easier to demand happiness than to clean up the environment. And so I think of that when I think of the question about what are best practices for organizational leadership during a health crisis. I think you know, it's far beyond what we're saying, and we're good. Comms people, we're very good at saying the right things to bring our people along and to tell people to take care of themselves. And it's not that we don't mean those things, but fundamentally for leaders, it's our job to clean up the environment. And so I think public health offers a great lens for this for all organizations. You don't have to be a health organization to think through the lens of public health. And once you see things that way, when you see systems that way, it becomes a very valuable lens on viewing people generally. So I'm going to share 3 sort of concepts today that from good public health, because to be clear, we don't always follow all of these ourselves that well. And so I'll share 3. The first is to view our people as populations. And so this is to say that the health of any population is a reflection of the health of the environment of people. So it's the systems and the policies, the norms that a group of people are subject to or rely on in an environment. And in population health, and I know some of this will be very familiar, and I'm sure there are people on the call today who are expert in some of this. But in population health, we think, of course, about the determinants of health, which are the underlying factors that contribute to or prevent people from being able to be healthy and be safe. So in public health at large, sort of, these are things like having a safe and comfortable place to live, access to quality childcare, money, basics. And those on the surface don't seem like health or sort of health interventions that we might say, but in mass, they go a long way and much further in ensuring health than any medical intervention. And then, of course, we know that the determinants of health are themselves determined by more structural privileges, or rather structural oppressions that are built into the systems, like housing, like education, that we all rely on. So those oppressions, things like racism and sexism and ableism. And so in our organizations then, to round this out, the task then is to think about what our own determinants of health are in our organizations for our people. the factors that make our populations healthy or not. And so for organizations, these are things like ample paid time off, healthy work hours, comfortable wages that are actually on par with what it costs to live in certain places, safe and healthy facilities, and on policies to ensure safety and accountability. And that's just kind of scratching the surface. But so that's the first. So viewing our people as populations. And then the second, to keep borrowing from public health, is that we are to believe that we are responsible for our populations. And I was sort of thinking about this, and I know that we're joined today by people from all around the world, but here in the US, I think a talk like this about organizations' responsibility to caring for the health of our people, and we think of it as a right. Health is a human right. In other places, some other places where the government is fully bearing the responsibility for providing its people with that right to health, this conversation might be quite different. But in the US, that's not the case, of course, and not by accident, because in the 70s, on the heels of the Civil Rights Act and on the heels of the Social Security Act that the updated Social Security Act that established Medicare and Medicaid, there was a growing movement in the United States, toward universal health care in this country. And of course, that's a whole other class and a whole other day probably. But of course, what happened was that Nixon then, rather than take us down the path of universal health care in this country, Nixon signed into law the requirement that employers provide health insurance to people, to their workers, effectively shifting responsibility for that right to health to organizations. And so it's this, it's this tangled web then. And I think that the point is that what's fallen through the cracks maybe, or rather is left to companies and organizations and institutions to decide, is what it means to each of our organizations beyond the legal requirements, what it means to us to provide that right to health to our people. And obviously even the legal requirement is often shirked. And so when I say that organizations that we're responsible, the second principle here, that we're responsible for our population's health, I mean that I think it's about a more holistic view of a responsibility to the health and well-being of our people. And I love the title even of the course here today is about listening and learning, and it's about listening and leading and about well-being. And I think that language is really important. And also just to say, I know, I'm sort of talking about our employees right now, but I think it applies to students, it applies to anyone who relies on and is subject to our environments as organizations. And I want to pause for one moment in this conversation also and just acknowledge that any discussion about the health of people in organizations, I think has very deep class dynamics. We're all sitting online right now. I'm able to do the majority of my job from my home. A lot of my colleagues aren't, who are on more of the front lines in public health, but there's this drastic privilege built in there. And in the US, it's something like upwards of 35% of people at this point work in the gig economy. And that increase has mapped with an increase of people who are involuntarily working part-time. That's on the increase. And so what that means is that more and more people are essentially working for organizations without, and yet their determinants of health and their basic needs are not being met by those organizations. So then the third thing, so the first being viewing our people as populations, the second being committing that we're actually responsible for our people's well-being and health. Then the third is, and Gabriel started touching on this, I think at the end a bit, but the third then is that our goal should be about equity for our populations. And so this is going a bit further and centering the needs specifically of those who face unfair or disproportionate barriers to being healthy in our environments. And so just going back for a moment then to that example of this increase of involuntary part-time work and gig work, from a public health perspective, if you take a click or two down into that data to better understand it, A, it's not accidental, and B, it's not sort of equal opportunity in terms of who is being subject to that shift. So in fact, it is Black and Latino workers, and even more specifically, it's Black and Latino women who are most likely to be involuntary part-time employees, and therefore more vulnerable to all of the burdens that come along with it. So lower wages, lack of benefits, and then therefore jump over to the determinants of health, lack of safe and comfortable housing, inability to pay for quality childcare. And you can see, but you see how we view these things sort of separately. Like those are those social problems over there, and those are jobs. And we're not seeing how, in fact, it's directly related. And so it's that type of understanding of our populations, and of how our policies and our systems impact people, that as organizations and leaders, I think that we have to constantly strive to better understand. And you know, I won't go into much more detail there, but public health provides this framework. It provides us the tools, things like how to research, how to ask the right questions. That's so much of what public health is about. Good public health is about asking the right questions to understand without assuming what values, what motivations your population has, if and how and why people are impacted by things. Public health helps us think at a population level. It helps us break our sort of easy to slip into pattern of thinking that one person's experience therefore reflects the whole. It helps us also recognize that those of us in power typically do not reflect the demographics of the masses or the experience of the masses. And even when someone does, even when those in power do represent demographically groups who face greater barriers, none of us can ever speak on behalf of all. And so it's about learning how to listen to the collective. It's more political. It's listening to what the needs are of a collective group of people in your organization. One other thing is how to question. It teaches us how to question surface level myths, surface level data, and maybe reject myths, I'd say it that way, around what people want or need or why people do things. There are so many good examples of this, and I know someone else is going to talk about vaccines and who is not vaccinated and why, and that one gets me, because if you look at the data, the number one group of people who have the least vaccination in the United States are low income, low wage working people who do not have health insurance. There are other reasons that people are choosing not to be vaccinated, but that's really important that we lose sight of. Another really good example there, and I'll wrap up here then. I think another really relevant example is this concept of working from home. And again, for the privileged few in the world who have the ability to do our jobs from home. But I think it was earlier this week that a mayor of a certain major US city, not ours, but he made some quip about how people shouldn't work from home because you shouldn't be sitting home in your pajamas all day, is what he said. And it's such a beautiful example of just kind of taking this surface level myth and repeating it, when in reality, all of the data about why people want to work from home, again, who have the privilege to, it's because it's about things like long, expensive commutes, which more unfairly impact lower wage workers, renters who live far outside of cities. It's about wanting to be around your family. I mean, I get to see my kid in the morning these days, and for years I didn't do that. I'm one person, but that's a theme that we see out of the data. It's about people's mental and physical health that can be improved by working from home. And so it's this, frankly, it's a lazy dig and a lazy way of passing along something and perpetuating a myth about actual people. And so finally, the other one I think that public health teaches us that I'd be remiss not to say is that I think it teaches us not to be deficit based also. And so to not just see problems that people face as deficits or as issues, but rather to see the value, the inherent value in the humanity of people in our populations. And so, and this could go on and on and on. But point being, I guess, and just to come all the way back to the question about leading through health crisis, I think as we've all seen with COVID, what crisis does is it exacerbates the cracks in an environment. And so, and there are cracks that are deeper for some groups of people and that are probably unnoticeable to others, often those in power who are able to make decisions. And so I guess in closing, I would say, I think the job of leadership through a health crisis, and frankly, it's in advance, it's constant, it's to be willing to reimagine the status quo. And rather than making choices that work best for most or work best for those with the most privilege, it's to be willing to make choices about our systems and our policies that privilege those who face the greatest barriers. And then it's best for all. So I will pause. Thanks so much. I'm happy to take questions if we have time or not. Over
yeah,
to
if you have questions for Carla, please feel free to put them in the chat and we can ask a few of those. I really appreciate so many of the points that you made, Carla, were reflective of our conversation yesterday about well-being and the idea that that is a collective concern, not an individual concern. And we were talking about well-being at work, but just the expansion of the workplace to society as a whole. And I really see what you're saying about the cracks. I think for a lot of us, the pandemic has kind of shown us some of the vulnerabilities in our society. And, in some cases, we've fallen back to those typical patterns of saying, oh, this person is, without a home because of something that they did, or, they're in poverty, or they're even unhealthy, or they're even sick with COVID because of something that they did. And certainly, there are healthy behaviors that we can take, but for the most part, those are social problems, right? Society-wide problems. So I'm curious to ask, my familiarity with your organization, with PATH, goes back to like kind of what I think of as a previous era when I was involved in international journalism. And I thought of PATH as a very like sort of internationally oriented organization that helped people in other contexts, outside of mine. And I think in the time between now and then, I've experienced, and like probably a lot of people, a transformation into thinking about, it's not other countries where these problems reside. It's right here, right? And we can see them more. It's probably always been true, but it's definitely more visible. So I'm curious to just ask how that transition has impacted PATH, or kind of how you think about, do you need the outsider view to see some of those challenges of your own society? And how does that relate to like the partnerships model that you work on?
Yeah, it's a great question. I actually, do you need an outsider view? I don't know. I think we've had enough outsider view. I think that in global public health, global public health is in theory this idea. It's sort of this idea of a fundamental belief in health equity, and so therefore, and an understanding then that it's not equitable, and that there are countries and communities that face greater barriers. In practice, a lot of the work we do, it's science, it's public health, it's launching vaccine, it's product development for things like vaccines or diagnostics, and getting them into the hands of people and health systems. It's improving those health systems. But in reality, the business of global public health, and I sort of say it with a capital B, it's a deeply flawed sector that, and we are, I think, kind of coming to terms with it and going through pretty major change. We're seeing donors shift, finally, truly shift, and say that funds have to, and just to say there, even the fact that there are donors and that charity has to exist is in itself a problem, and it shouldn't be that way. Countries should have the ability to provide for their people. It's not the world we live in today. And so if there's going to be charity, then donors are starting to shift, and they are starting to allocate dollars and resources to locally led, locally based organizations. The majority of our team members are in countries across Africa, Asia, some other countries like Ukraine. We do have a big team in Ukraine who we're all thinking about right now. But I think we're in the midst. So I don't have this perfect answer because I think we're in the midst of it. And I guess if I could wave a magic wand, it's the kind of the advocacy idea of nothing about us without us. And I think we have a long way to go actually to doing that. And so that would be, if I could wave a magic wand, it would be that. It would be that communities have real agency in their health, and that it is more in real collaboration, and that the power dynamics are resolved. That's not where we are today.
I have a quick follow-up question too, Carla. Again, thank you so much. We're getting a lot of comments about how insightful this presentation was. In terms of, I know you laid out this kind of perspective and awareness that organizational leaders should have, that they should borrow from the public health principles, knowing that we'll always have pandemics, and knowing that now that we know, which was always the case, that our constituents and our members' health is always at stake. Could you share with us an urgent practice organizational leaders should adopt? Because we've kind of responded on the spot this time around. What's something we should invest time in, and we should definitely implement as a sustainable and consistent practice moving forward as organizational leaders?
I love that. I love that question. Yeah. So we've always known that there are pandemics and that there will be more pandemics and epidemics and other crises, but we love to forget about it and pretend that that won't ever happen again. And so in public health, we talk about the panic and neglect model of funding. And I think the exact same applies to organizations. So like all of a sudden, all these organizations are doing things that are good, really good things to better take care of the health of our people. But it follows that very same pattern of this panic and neglect. And so then it's like, oh, well, the pandemic is happening, and therefore we should let people have this extra paid time off to take care of their families or something like that, right? And then it goes away. And so it's that. It's not, there isn't one specific thing. It's that, it's what you said, it's more consistent, stable care. It's the fertilizing of the foundation of our environments that we can't take our eyes off of. Otherwise, cracks develop, and when the pandemic hits, or any other crisis, it will fracture.
Yeah, that consistency matters, and exactly doing it all the time, and not just now. Thank you so much, Carla. This was so insightful.
Yeah, thank you, Carla, for joining us. And I'm really appreciative that you brought up that question about the common factor among unvaccinated people for COVID. That was coming to my mind as well. And I was really surprised when I first learned that, because I had some of the same perhaps myths in my head about it as well. And I think it speaks to questions about trust and being disenfranchised from systems. And then it's hard to re-engage people to trust those systems if they haven't served them in the past. So I think that's a great segue to talk to our next guest, who is a postdoctoral fellow at the University of Washington Center for an Informed Public, which since its founding has been a frequent collaborator with the Communication Leadership Program. Kolina Koltai is one of the foremost experts studying vaccine misinformation on social media platforms like Facebook and Instagram, including how community is built around vaccine hesitancy, and not just COVID vaccines, but other vaccines. This isn't new work, right? Coco and our students have been collaborating on a campaign with UW Medicine and the Center for an Informed Public to address vaccine hesitancy in pregnant people. So this expertise is really something that hopefully can be applied to making real change to help people, encourage people to take healthy behaviors. So Coco, I wanted to frame this somewhat as a conversation. You and I have been in weekly meetings around that campaign. So I know a lot about what you know, and I know that a lot of what you do and the interviews that you give are typically sort of framed around the hows. How does vaccine misinformation work? How is it propagated? How does it spread on different platforms? So I wanted to try to talk as much as we could today about the whys, and start with a question of just why do you think that vaccines and other health decisions that people are in, personal health decisions, are such fertile ground for misinformation?
Yeah, and I think that I want to thank everyone for being here for this conversation, because I do think it's really important. We're still in this pandemic. We're not all the way out thinking about vaccine misinformation. It's not going away anytime soon. And just like I think a lot of other health topics or topics that have a lot of like life impact, it's the meaning that gives us the opportunity for misinformation to really spread, and particularly impactful misinformation. Misinformation itself is not new. You can even imagine, you sometimes even hear a hoax about a celebrity's death, but generally that gets corrected very quickly. And really, in a sense, it doesn't matter, whether or not, say, you should get vaccinated because you think the vaccine might be risky, that really matters. And so when something really matters to us, it's something that impacts our lives, something that is an important decision, it gives opportunity for misinformation to flourish, and for particularly when there's people who can profit off of it by pushing a different idea, particularly when it's new, when there's a lot of uncertainty about something. So particularly when vaccines were coming out new, when a lot of things we didn't know about coronavirus. Even today, there's still people arguing about like what we know and what we don't know, what's the best way to do so. I think you could take just about almost any other like sort of controversial health topic or scientific topic, and you'll see that there's opportunity for misinformation to flourish. And so it was always something that was like a fear of mine prior to 2020, that vaccine misinformation and health misinformation was going to explode. And I feel like some of my worst fears came to fruition. But inversely, I've really been heartened to see so many people really trying to combat this, working in their communities, a lot of local and national organizations trying to really encourage people to get vaccinated and combat bad vaccine misinformation out there and bad actors.
Yeah, and I'm interested to hear some of what those interventions look like, and kind of see if there's any learnings in what works that might even map to other health behaviors or even other crises. But first, can you give us a little bit more about like what does vaccine misinformation look like? I think maybe you've brought some examples that you can kind of show us. I think many of us have probably encountered it, but if we're not in those specific information ecosystems where it really flourishes in those kind of corners of the platforms, then perhaps we don't really know how it operates.
Yeah, absolutely. Let me just share my screen really quickly. I have some few examples that we can kind of go through. As you pointed out, there are a lot of different ways we've probably even been exposed to vaccine misinformation. Some of us might have heard things, it's like more conspiratorial things like, oh, does the vaccine contain a microchip, or does it magnetize you, things like that, or even just things like, is it safe? These are even concerns like, are people worried about it being developed too quickly? But before I go into the examples, I want to be clear about two things when we talk about vaccine misinformation, and particularly about vaccine hesitancy, is that there's a difference between narratives and factors when people think about why someone might be vaccine hesitant. And as Carla mentioned, there are many reasons why people maybe don't necessarily vaccinate, which not always is related to vaccine misinformation. We think about particular models of like, convenience and compliance and a variety of different factors, like easy access. These are all additional factors to why people may not vaccinate. But there's also things in relationship to misinformation. And particularly when we think about misinformation, it's important to think about narratives that lead to a larger ideology of why someone should not get vaccinated, not just the specific bit of misinformation. And I'll show some examples. But it's always important to think about what is this bit of misinformation really trying to say. And it's not always clear of like what's true or false when it comes to misinformation. So as an example, we often think about vaccine safety. This is a big one. You might hear this narrative that vaccines are not safe, and it's not safe to get the COVID vaccine, may not be safe to get an HPV vaccine, and so forth. And a real common example you'll see is this something we call decontextualization of VAERS data. And VAERS is the Vaccine Adverse Reporting System. You may have heard this. This is a system that is maintained by the CDC that collects a bunch of vaccine injury reports. And so you might see posts like this, where it's saying like, oh, here are vaccine injury numbers. He says VAERS COVID vaccine adverse reporting. You'll see a lot of these clear that's like, oh my gosh, look at how many reports. This is actually from one on the right here is a well-known anti-vaccination activist website that says, look, there's all these deaths related to the COVID vaccine reported VAERS, and VAERS seems very legitimate because it's run by the CDC. So just looking at this, you're like, my goodness, there is, this looks true, it looks real, it's looks all these like risk of injury from the vaccine. Why aren't people talking about this? But in reality is that these numbers don't tell the full story. They decontextualize what it really means. So for example, with VAERS, anyone could put in a report. And so if you go into the system, you can see that sometimes people put in a report saying, I got vaccinated and I got hit by a car, or I got vaccinated and XYZ happened and I got superpowers. And you see a lot of like reports like that. And so you realize that there's actually zero legitimacy in what is it being flagged, because anyone can go through. Sometimes these are going to be real things, but sometimes it could be like, some people put things like, I felt really sick, like maybe I got like the flu after I got the flu shot, or I got a stomach ache. So people, and so it's hard to tell like what it is. So there's no sort of follow-up that's happening with this. In addition, they use the word adverse events. And so adverse events is a very technical term by the CDC of like, what is anything that is a negative? But that sounds really scary, sounds really bad, but really adverse event could be anything, including a sore arm, redness at the injection site, minor things. So you see reports and hear people saying like, yeah, my arm is sore for a couple of days, which we do realize is a very sort of acceptable side effect from it, but it could still get flagged in the system if someone wants to go and put it in there. Again, not verified cases, and this is really designed by the CDC to be used as a signaling system, and it does work. So if people remember back in, I believe, early 2021, I believe it was, there was these reports and worries about a potential rare blood clotting issue with the Johnson & Johnson vaccine, and those were all signaled through through the VAERS system. And so by having like really truly legitimate reports and it being used as a signaling system, it works. And so they were able to pause the Johnson & Johnson vaccine, investigate those reports, determine the risk, figure out what's the best course of treatment, and then continue on. And so the system is designed to be as a signaling system, not necessarily as a repository of all vaccine side effects. And so it's really easy to decontextualize what does VAERS data mean with these really scary numbers, saying, look at the thousands of reports or thousands of deaths, but in reality, a lot of those deaths are not real, they may not be related, and even ones that are from early on, I've gone in there and looked at reports myself where it might be someone at a nursing home and you see the nurse reports it, saying, look, person had terminal renal failure, they were going anyway, but we were vaccinating everyone in the nursing home, so they got vaccinated and then 3 weeks later they died. Is it because of the vaccine or because they had terminal renal failure, but it still gets flagged as a death in the system because it's part of our reporting. So the system works. Oh, go ahead. Yeah.
I just want to stop you right there to ask a follow-up question before you move on, which is just like, what is the point of that system? This is from somebody in the chat, if it can be abused? I mean, I understand you're saying that it's for tracking those kinds of problems, but maybe what is the point of it being public if people are exploiting it? Like, do you feel that it should be, the data should get private, or is there like an advantage to it being public?
You know, I think at its heart, you know, the CDC, I mean, we all have probably our thoughts on how the CDC's handled the pandemic, but I think part of it is that it's, you know, you want data to be public, right? I don't know if I would necessarily advocate for things to be less public. It's just, it's really unfortunate that this system has gotten abused, and particularly I think, you know, from bad actors in the space, like the medical professionals and people who are aware of the system who want to be able to use it should be able to use it to flag it. And it shouldn't be, it's unfortunate that it's a tool that was designed to signal if something is going around with the vaccine, which is probably the best way to do so, is being abused by people who don't really fully understand the point of it.
Yeah, that makes sense.
Yeah. Let's see. And then I wanted to show a couple examples. So we might see that this might see let me go back. These VAERS is like something that might be more like some bit of truth, not a lot of bit of truth. It's decontextualized, which is a misleading, misinformation type tactic, if you will. But we also see this happening with like really extreme things. We're still today, these are all like recent posts in relation to people still thinking like chips and magnets are a potential side effect, talking about this like larger ideology that vaccines are not safe, this larger narrative, right? So there could be different bits of misinformation that feed into a narrative, right? And so when we're thinking about trying to counter and address misinformation and address vaccine hesitancy, it's not just about debunking or trying to correct each individual bit. We got to think about like, what is it this bit of misinformation lead to thinking in relationship to the vaccine? And in this case, vaccines are not safe. And so just to kind of touch on, because I don't have a bazillion, if we had like all day, I could talk about vaccines all day. But the narratives you might even heard just in your day-to-day life is like, you know, is the vaccine safe? Is it necessary? Do we even need a vaccine? Do kids need the vaccine? Is it effective? Is it actually helping? Or because there's breakthrough cases, you probably have heard stuff about like, well, I'm not worried about how quickly it was developed, who developed it, how is it distributed, who is prioritized. You might have heard things in relationship to political or economic or historical like motives or reasons why you should be hesitant to trust the vaccine. Definitely that heard stuff about relationship to like these liberty and freedom ideas. Definitely this conversation about whether vaccines should be mandated and whether, you know, and you know, even to a lesser degree, but still really important, is, you know, being tied to morality and religion. Like maybe it's not depending on who it's talking about, saying it's actually probably you shouldn't trust the vaccine. You should be trusting like God or some other religious figure instead of that to protect you, or if it's your time to go, it is your time to go. And so what's really important to remember is that misinformation is not as easy as saying something is true or it's false, right? It's not this clear binary. And as you can see with that bears example, there is a lot of gray. That misinformation could be misleading information, even though they might contain a small like nugget of truth, right? So it takes a lot of work to parse through things, particularly when they look really true, which is why I think vaccine misinformation is so impactful. People are really good at taking things and decontextualizing or making things look legitimate and true. And people don't realize where that data or where that bit of information came from. So it's always important to think about narratives, right? What is this bit of misinformation or what is this bit of content trying to really convince us of? And I want to show a couple of examples really quickly of like what this even looks like in a variety of other forms. So this is a post I took off of Instagram. That's a video. This is all relationship to masks, where someone's saying like, oh, they're blowing, like they're vaping through a mask and you still see smoke coming out. And you said doctor proves that masks don't work. But when I see this, I actually say like, well, it's unclear who this doctor is. They didn't say who this doctor was. It's ignoring the fact that it's actually preventing a lot of the smoke from leaving versus like vaping without a mask, so it's restricting a lot, and that vape smoke is not the same as droplets. So it's very misleading, even though we see this visually, we see it's happening, like how is this video fake? The video itself is not a fake video, which is a whole other thing, but you see how it's shown in a really misleading way to say that masks aren't working, when really that mask we do know to be effective at preventing the spread of COVID. And then you'll even see things like this, which are some of the harder bits of misinformation to really counter and try to walk through people, which is something that looks legitimate, like from a peer-reviewed scientific article, which is what people say, like, gotta look at the science. And you'll see a post like this that says, looks like it's from a scientific article, and they pull a quote from it saying there's no good evidence that face masks protect the public against infection with respiratory viruses like COVID-19. So it's saying masks don't work. And you see this, and I'm like, wait a second, what the heck is going on here, right? So I go to the article, which looks, from here, they say this is a study that was published in the journal of Pediatrics. I was like, is it though? So I pulled up, this is the entire length of it. And if you're familiar with reading studies, they're usually a little bit longer than this. So this is actually not a study, even though the post calls it a study, it's an opinion piece. And it has a lot of retracted citations. This is specifically for an Australian New Zealand context in June 2020, which had very different numbers than we imagine in the US. And we're like, what does that quote come from? So here's the quote: there's no good evidence that face masks protect the public. And so I'm like, okay, they're citing it from something. So what is it, a study that says this? So I go to the site, and I'm like, well, actually the paper they're citing advocates for masks, the rational use of face masks of the COVID-19 pandemic. And I'm like, so what is happening? What it is, in the intro, they discuss that there's an argument that some people are saying face masks don't work. Even though the paper itself, like some people say face masks don't work, we're arguing that face masks are necessary. So we can see how like this really bad opinion piece in a very specific context, and partially even what that piece is saying was like they needed to maybe prioritize who's wearing masks, which is a part of the nuanced conversation of an opinion piece, not a study, but we see how that piece of scientific peer review journal article, which is not, is being used to advocate this thing. Science is saying you don't need to wear a mask. But this is a lot of work. This takes me time to go through and read all these articles. And so I'll stop the share right there on that. There's countless accounts of examples to see like what does vaccine or like health or COVID related misinformation looks like, and it takes so many forms. It's not just the crazy magnet stuff. It's stuff like this, which I think makes it really difficult for anyone, even doctors, even people with PhDs, to parse through all the data to figure out like how do I make a decision then when you're encountered with stuff like this.
Yeah, it speaks to that adage of, a lie gets halfway around the world before the truth can get its pants on in the morning, or whatever it is. There's different versions. But the way that you were able to go through and do all that digging to get to the bottom of, where did that piece of misinformation come from? That's probably not, is that what you would do when you encountered, say a loved one or an employee or somebody else in your organization who was sharing that misinformation? Like, is that the best approach to kind of like break it all down? It was a many step process, right?
It's a many step process, and it honestly depends. So the big follow-up question is like, how do we help people who maybe are believing vaccine misinformation. And, there's no golden ticket. I wish there was, and we probably wouldn't be in the big mess we are if there was one perfect way. And the step process I showed you, that's going to work for some people, but it's not going to work for everyone else, because, there's so many bits of misinformation that we can debunk. But I think a lot of the tools that I would just address to anyone who they're trying to like determine whether if something is misinformation or not, is to kind of like is using this like SIFT technique. But basically you want to trace back the claim. Where is this claim coming from? You're saying, oh, here's the proof and evidence that XYZ is this. And you have to do that tracing. And that is going to help, because you can help teach your loved ones how to debunk misinformation just by even looking at like, all right, you say that here is an article. Like even my own father would send me articles of saying like, oh, look, here's proof that like vitamin C and vitamin D is working to prevent COVID. And I was like, well, let me go look through the articles. And I kind of talked it through him. My dad, English is a second language. He didn't finish all the way through high school. He's an immigrant here in this country. And I had to like walk it through it with him. And then he was like, oh, he still had hesitations, but I think he felt a little bit better saying like, now that he understood what the article is saying, not just like, oh, vitamin D. And so I think it is tough, like to always talk to loved ones about COVID, health related stuff. It's particularly like I am not an immunologist, I'm not a virologist, and that's not what my degree is in. And it takes me a lot of work. So it's really difficult to do. So I think the other things that I continue to want to tell people about this is like to have compassion. I think leveraging your personal relationship with people is going to be much easier. I think I have a better time trying to convince someone to vaccinate that is someone within my network versus like a random stranger online. And I think part of that is like, you need to know what is happening. What is the misinformation that your loved one is seeing, so you know how to talk to them about it. So if your loved one is saying, look at all the various reports and the numbers, like you can go through it and be like, okay, let's talk about that. And you don't dismiss them to say that they're wrong. You don't say like you're incorrect. You say like, well, that's part of the story. Let's talk about the rest of the story when it comes to VAERS data, or the rest of the story when it comes to the efficacy of vaccines. And we could show the numbers that are saying like, look, here's all this additional evidence saying that vaccines help protect you. Even if you catch COVID, your chances of dying are much less. Your chances of having really severe side effects from catching COVID are much less. And we need to have that conversation to address the counter some of the misinformation narratives they might be hearing.
Kim, did you want to ask a follow-up question?
Yeah, I mean, I just a quick comment is this, relationship between debunking and convincing, because I almost feel like, and I don't know if there's research around this too, at least my experience of talking to ones who had, a kind of occupied a different information landscape filled with misinformation, has been that debunking led to more defense, as opposed to convincing them towards a new path and understanding towards how we should approach, vaccinations or other public health related decisions. So do you have any thoughts about that? Is there kind of a maybe negative side effect of sometimes trying to debunk someone who occupies such a different, information landscape?
Yeah, I think for one, I think it's never going to be done like in one session if you're trying to convince someone to vaccinate. There's even someone in my own network who just recently got vaccinated like a few weeks ago, got his very first vaccine. And so sometimes things take time. And I think it's not about debunking, because debunking implies like you're trying to correct a bit of misinformation. Oftentimes when it comes to vaccine misinformation, is things are presented in a really misleading way. So it's never about like saying your bit of information is wrong. It's like, well, let me show you this alternative way. Look at something that I've seen as well about the very same topic. And so it exposes someone to another bit without saying, they don't have to lose face. They don't have to think, like being told that you're wrong or finding out you're wrong. It's really embarrassing. I hate being wrong, even though it happens all the time. It's not a great feeling, right? It's particularly when it comes from a loved one. So I think it's really important to always be kind when you're having these conversations, because these are going to be really difficult conversations. And it's so easy for us to get passionate, because a lot of us are really passionate about vaccines and wanting to end the pandemic and health, and the health of our loved ones, and it's, I think, continuously, if you need to take a break from the conversation, take a break. We don't want to have anything. There's sometimes this idea of like backfire effect, that like just try to give people like alternative information, or like say like, oh, just read this instead, is not necessarily the best tactic for everyone, which is why there isn't one clear tactic. You know, it might help with some people to do the walkthrough component like I did. It might help just be like, well, let's talk about those fears and concerns and maybe leverage your own personal relationship. Like, I'm really concerned about your health, and like, I love you and I care about you and I want you to vaccinate because I do think it's the best thing for your health. There's all these different ways, but there's no one perfect solution. In the same way that we advocate for tailoring as to people's like individual like health needs, like the thing that like for there's not like one set, like here's your health treatment plan. You want to tailor the health treatment plan. You want to tailor the conversations to what are the concerns of your loved one. Like, why are they so why do they have that vaccine hesitancy? Is it because of misinformation, or is it not because of misinformation? What are their worries? Are they worried because of risk? Are they worried because of like this like loss of freedom idea? Like, I don't want to be told what to do. That's a very different approach than say someone who is like, I just think it's dangerous, right? You know, it's don't just go in saying it's wrong. And it's hard because this is a conversation you need to get really there's no training for. There's no good knowledge of like, here's how you go and train and practice of how to have a vaccine conversation with a loved one, because there's no one way to have that conversation.
Yeah, these are really like emotionally and sometimes politically charged conversation, but I really appreciate your framing around, we're talking to our loved ones, right? People that we care about. And the reason that we care, even if it's not somebody who's that close to us, the reason that we care is because we're talking about our shared well-being, right? So it's tempting for it to feel like you're trying to win an argument. And that's often where I've gone in these kinds of conversations, but really what's important is the continuing care, right? Is probably the most sort of disarming thing is I care about you. And yeah, that I'm tempted to, I've been wanting to bring up throughout this session as we transition to our next speaker, that there was a report that I'm sure you saw, Coco, about the IHME, the Institute for Health Metrics and Evaluation, did like a kind of longitudinal study on country to country COVID infection rates, and the most common factor for lower infection rates from very different countries and contexts in relationship to wealth and pandemic preparedness and everything was interpersonal trust and trust of the government, right? The countries that already had high levels of that trust did really well on keeping COVID infections down, and the other way around, which really spoke to me that wow, it's so important that we're able to build that trust, even when we're not in the middle of a crisis.
Yeah, absolutely.
Thank you for joining us, Coco. I want to transition to our last speaker, who is Cyan Wu. She is the managing director of Resource Media, which is a unique nonprofit communication firm that works in support of social change. Cyan has 18 years experience running communication and public relations campaigns related to social change, sustainability, community development, and public policy advocacy. And she has guided her clients through the complex challenge of furthering their marketing and communication goals in the midst of one or many crises, including through the pandemic as well. So Cyan, I'd love to welcome you and start our conversation there. How have the collective crises of the past few years changed the nature of marketing and communication work with you and your clients?
Yeah. Thank you so much, Alex, and for everybody to help make this conference such a success and go so smoothly. Yeah, so for us, because we work exclusively in the social change space, the world's crises are really our crises. So when COVID hit, we were just like everyone else. We were no longer separated from the people who were facing this crisis we were living it. And so COVID was really that equalizer that affected everybody. But at the same time, we knew that there were people who were disproportionately being affected, like frontline workers, those with inadequate healthcare or family supports, et cetera. So I remember when the pandemic hit, some of our clients who were working on things like energy efficient buildings and ocean conservation were trying to make plans on how to address the pandemic in their business as usual communications, their newsletters, their social media, et cetera. Trying to say the right things. And I remember that, we had to tell them, the people that you're communicating with have possibly had a family member die or are in the hospital or are dealing with childcare issues or have staff members who are sick. And it's just it's important to remember that your issue of the day isn't always about getting your message out and taking advantage of the issue or the crisis at hand. It's about taking care of your audience. And so the pandemic really drew that to light, to show that we are members of our community. We're not just trying to communicate something out to them. We've dealt with many crises. So one thing I remember working on is working with the team in the aftermath of the Atlanta spa shootings. So I don't know if you remember this, about almost about a year ago last year, there was a shooting rampage in the outskirts of Atlanta where several Asian American women spa workers were shot and killed. And so we were working with the local Atlanta team on their communications, and some of the families didn't want the names released, or because of communication differences or difficulties in working with law enforcement and these nonprofits, it was slower getting the family approval of that. So we as a team, we knew that this was not an ethical way to go. We wouldn't want to advocate for their names to be out there if they didn't want to be. But at the same time, the media was already reporting on it. And so once one national media outlet starts reporting the names and getting the names, then everyone else jumps on board, and we're just kind of waving in the distance, so what can we do? So just know that when you're working in large coalitions with lots of activity that's happening during a crisis, things can get very messy. But one thing that we did do was we worked on a pronunciation guide with the Asian American Journalists Association. So with the message, if you are going to say their names correctly. So yeah, just a little bit of insight into some of the things that we deal with on a day-to-day basis, working with clients.
Thank you, Cyan. That makes me really think about when we first started talking about having this conversation. We talked a lot about, or you pivoted to ethics very quickly, which of course I can see how that informs the way that we do communication. But I was definitely thinking more in the mind frame of efficacy, and ethics came up for you first. So I'd love to hear you talk a little bit more about either some of the kind of ethical pitfalls that have come up, or how do you advise your clients on ethical, especially marketing, in the midst of these crises?
Yeah, I mean, there are many pitfalls. So yeah, I'd like to differentiate kind of between the types of organizations and groups who are likely to be on the front lines of crisis and those who are more often than not kind of in the background. So one thing that we've seen, which is kind of demonstrating the types of silos that these organizations tend to be in, is that we've seen organizations, not pause advertising, not pause their scheduled posts, their newsletters, and things like that, when larger scale crises or things that are very much at the forefront of frontline groups are happening. So, following the killing of George Floyd and the BLM protests, there were some people who were still posting advertising on things that had nothing to do with, justice organizing or anything like that. And it just seemed kind of unaware and exposed how deep these silos are. So again, it's not just about avoiding being called out, but it's also about taking care of your audience. Another thing that we've seen is not really considering the impact of compounding crises. So we know that, the news media will have a never-ending appetite for stories that invoke fear and anxiety, because that's the emotion that will elicit the most response. But as a brand and as an organization, you can make a choice to not put as much pressure on to your audience, even though it may get more clicks. So there was a cartoon that I saw. I'll just share my screen really quick. 1 second. You may have seen something like this in going around on social media, and people might say, "Oh, haha, that's true," thinking about those compounding crises. But what is the mental state of the person after thinking about all of these compounding crises? The mental state is likely, I give up. I can't, I turn off, I need to take a break. There's just so many, it's too overwhelming to think about. And that is not a very helpful or action-oriented place for the person to be, even though it may have resulted in a click or a share or a like. That's not ultimately the most helpful space for that audience.
Yeah, I can I can definitely relate to that graphic, and even just thinking about that decision, knowing where your audience is going to be at is hard. I definitely woke up this morning, to the Ukraine news and was kind of wondering, how big is this? There are so many different crises built on top of each other that it's sometimes hard to know how people are reading those things. What is a, kind of stop the presses moment? And it sounds like, that might be different for different people. So you really need to know, kind of who's in your audience and what is gonna read as insensitive to them, or in fact be insensitive. Yeah, that's a tough question for sure. I would love to come back to the question, and I think it's related, that we were talking about earlier, of trust. Just thinking about, particularly, you've done a lot of health and pandemic communication, and it seems like a lot of, from looking at that work, a lot of it is related to building trust in your audience. Can you talk a little bit about how to do that? How can especially health communication effectively build trust with audience?
Yeah, I mean, it is really tough. And I think that there are some short-term ways to build trust, and there are also long-term ways to build trust, in which case sometimes it is too late, or will take many, many years to undo. So for example, what we saw with vaccine hesitancy, even before the COVID vaccine came out, is a lot of the folks who are most likely to be vaccine hesitant were women, and especially women who had kids. And we know that there's a lot of misogyny wrapped up in typical average women's first experience with the large healthcare system, which is hospitals and giving birth. And that there is a lot of history of not listening to women, not listening to pain, having escalations of birthing plans going out the window, sticking needles into people and not really telling them what they are, et cetera. And so then it's not really a surprise that later on down the line, when your pediatrician is saying you need to get all these vaccines, that women who had negative experiences or some trauma around that are going to be like, I'm going to do my own research, thanks. That then snowballs into COVID vaccine hesitancy, and maybe some of the populations who are adopting some of those mindsets as well. So in that case, it's sort of receipts from the medical industry kind of catching up with that population. In terms of short-term trust, one key thing to realize is that trust in government agencies is not necessarily the end goal if you have a larger behavior at stake, right? So it's really, we would just want to make sure that you are taken care of, and adopting the mentality. It doesn't matter if you're getting the trusted information from us or from your friend, if you are taking up the right behavior and the right action to lead to better health. So one way we did that was we partnered with leaders who already have that trust in their communities. So community healthcare workers, the owner of a cafe, a bakery, a Mexican folklore dance teacher. And this was a campaign that I can share with you all on this slide here. This was the Why Now campaign with Public Health Seattle and King County and COVID Conversations. So this was geared toward having open conversations about the COVID vaccines and having them be unscripted and just seeing what people said, and then taking that and turning them into videos. At this point in the pandemic, there were not a lot of public conversations that were happening about the COVID vaccines because the enthusiastic people who were lining up and ready to go had already gotten their vaccines. And then there was a lull with people who were more hesitant. And so so we really kind of wanted to model that the types of conversations that you can have with family and friends, and just kind of bring to light these very real fears and how people got over them through the series of videos and advertisements. So I can share this if you want. Okay.
Yeah, that would be great.
That sound comes through.
Yeah, let's see. Oh, maybe we don't have sound.
Okay, let me just. Can you hear that?
Mm-hmm.
Okay. this was just a compilation.
Down syndrome.
Working at Target.
Panic.
Pastries.
The moment is now.
Ahora el tiempo de ayudar a la comunidad.
Ponte la vacuna.
My mom.
My uncle.
My family.
My family.
La comunidad.
Plan a trip to Jamaica.
看烟花.
Going out and hanging with friends.
The beauty of living, the best thing is to breathe and live.
So that was just a compilation video. And then we did a series of other videos that delved a little bit more deeply into each of these conversations. So the idea being, you know, it's not the finger wagging government agency that says you should do this because of these reasons and I'm so right, but listen to your community members and really kind of living out that idea of social norming. So when you see someone on the screen who looks like you, looks like your family member, speaking your language, and who is saying that they got the vaccine and they were, you know, a bit cautious, but they got over it, and these are all the freedoms I can enjoy now, you're more likely to be able to take that up because you trust that person. Or maybe you actually know that person because all of these people are active in the community. And so we heard back like, oh, it was great to see, you know, Hannah in that video. So yeah, I can run through a couple more of these if you like.
Yeah, I mean, I would love to, before you do that, just talk a little bit about, this is reminding me of something that Gabriel was saying as well. How do you get this requires a certain amount of authenticity and of vulnerability in terms of these people aren't going to necessarily stick to the talking points, right? Like maybe your client, in this case, the public health authority, might have kind of decided what we want to communicate, and you're really asking them to listen as much as they are talking, right? And hear how people are having these conversations. So that must require some building trust with your client, right? And I'm sure, I bet Gabriel experienced the same thing going into, you know, a government institution as a journalist and wanting to like bring his storytelling instincts. And I'm sure that a lot of our students and members of our community will experience the same thing as they try to get their organizations or their clients to listen to them about what is actually going to work well. So I'd love for you to talk a little bit about how you do that. I mean, specifically, you have to redo that every time you have a new client, right? You have to kind of get them on board with the efficacy of what you're going to do and your approaches, right? Can you talk a little bit about how you do that?
Yeah, I mean, I think specific to this campaign, you know, it's not as if public health had not been telling people what to do through various PSAs and advertisements. They've been doing that for months and months. And I think that they wanted to try something that was a little bit more grabby. I think that it was a lot of kind of eyes glazed over kind of thing in terms of, you know, another meme or little message that says how vaccines are good for you. But how can we, if we're going to get to that movable middle, so the people who are hesitant or watchful or concerned, they're not going to be moved by the vaccine is good for you argument just straight as it is. They're going to want a little bit of ingenuity or uniqueness, and we can't necessarily just come up with that, add a speech bubble on some stock photography and then call it good. You know, we want to really connect with community. And, you know, public health had been doing some really fantastic work building up the infrastructure to allow for that kind of community engagement for a long time. So they had a community navigators group that they had set up just on the onset of the pandemic, where they're working with community members and compensating them for their time for feeding information that they're hearing from community. What are their needs for PPE or for education or vaccines, et cetera, and developing templates and pieces of information, you know, fact sheets, PSAs, things like that, that then they're pushing out in dozens of languages. So they already had the infrastructure to allow for this more community-oriented type of content campaign. So, yeah.
So building long-term relationships building trust long term rather than just jumping in when the crisis happens. Okay, well, we're running out of time, but since you're our last speaker, I did want to ask you if you can maybe leave us with some words of hope or growth, as you've worked on so many different communication campaigns and throughout a number of different crises. Do you see things that are changing? Do you see things that give you hope, or do you have like specific practices that you have adopted to kind of preserve your own well-being as you help navigate people or your clients through those?
Yeah. I think that different people have different stores or abilities to work within crises, and different things feed them. So for me and some of my coworkers, we are sustained by the work. We are energized by helping. We say, with the family separation crisis at the border, for example, we jumped in and helped to raise the Washington Bail Bond Fund to release folks who are held in federal detention. At that point, we were talking about this is really hard. A lot of us are coming from families of immigrants, but we felt those busy hands were happy hands. We felt good about helping to alleviate a crisis rather than sitting back and just letting it wash over us and being worried. Other people think this is too close for me. I gotta tune out, I gotta leave. And that is totally fine. So recognizing those differences in ourselves and our coworkers, and thinking about those different stores of comfort that each of us have, and being aware of our various different levels of privilege, I think is really important. But for me, I think in terms of personally what I do, I think it's if we dive too deeply into the intellectual, the endless fountain of words and the news reports, it can be very easy to lose hope. But I found that if I take the time to connect with community, and it's much easier to find moments of hope and moments that surprise us when we do that. So I pursue hobbies and activities that spark like culture and fascination, ambition, like just cool stuff that I want to do. One thing I've done for the past few months is I've joined a group called Double Dutch Divas, and we double dutch on the weekends. I turn ropes for kids in the elementary schools, and just seeing their faces light up when they're like, I got it. It's just like simple joys like that. Just really make you remember it's not all about the crises and the worry and the anxiety. Sometimes it's just about, achieving a goal, no matter how small it is, and connecting with community. So
thank you, Cyan. That's great. And I still have not gotten double dutch, but maybe I'll come someday and
yes,
see if you
I'll invite you.
So I would love to extend that question in closing to the rest of our panelists as well. We're all dealing with like a mountain of crises and a lot of difficult work. And yesterday we were talking a lot about preserving our own sort of individual well-being and the collective well-being at the same time. So I'd love to invite our other panelists back to hear just like a little bit about what makes you hopeful, or what you have been doing personally to try and sort of keep going in a time when it sometimes feels like things are really difficult, and maybe there's no end to the work. Anybody's welcome to pipe up first.
I think one thing that's really important to know is that like you're not the only one, I guess, trying to do good in the world. That there are a lot of other wonderful, like smart, dedicated, hardworking people who are just also trying to make the world a better place. So it is not a solo fight.
I am better equipped to listen to answers to this one than give them, unfortunately. But I am I'll cite my wife, because she's better at this than I am, and she's had a very similar trajectory, in that she was also a reporter. In fact, we worked together at KNKX, and then now she works for the Department of Health doing communications. So the Washington State Department of Health. So the things that she does that I wish I were better at are keeping a gratitude journal and forcing our children to enumerate things every day that they're grateful for. And also she started cartooning. So she's keeping a cartoon journal. And it's been so I've lived vicariously through it. So it not only is a kind of a joyful activity, but it's also chronicling this very weird time in all of our lives. So that's what I got.
Thank you, Gabriel.
Yeah, I'm happy to respond to it. I mean, it's the balance of the sort of survival of self and survival of collective, and where you're giving your energy, right? And so I think mine, I don't know. It's hard work, and I think for those of us whose work is the pandemic and it's just kind of nonstop often, and you're living and breathing it sort of everywhere. And so I don't know. I think we have this really wonderful, we've been privileged to work with this very wonderful DEI consultant, Aiko Bethea. She's like a Seattle legend, not in Seattle anymore. And she talks pretty eloquently about how, and I know how crass this sounds, but she talks about don't kill yourself for your work. It is life-saving work. It is critical what you're doing, and they need you alive. And those are her words. And I've taken that to heart. So stepping away and taking space and prioritizing family, and prioritizing your own health. I've tried. It's a work in progress, but that's stuck with me.
Yeah, it's very hard to stay true to that, even when you kind of know that or hear that advice, even from yourself. Sometimes it's hard to follow it, right? When you feel like you do, your identity is tied in with making change and building progress and making the world a better place, which I imagine is the case for everybody on this panel. Well, I want to thank all of our speakers for joining us today, and everybody who has participated. Ken, maybe you can help me with the transition to our breakout rooms. We have a question that we want to put to you, our participants, as a collective group. Go ahead.
Yeah, so we will have quickly a chance to talk about what you're going to reflect upon completion of this program. And that is, we're asking you to share with us a learning or a tool or something that you can bring back from today to your places of current and future work. There's a lot that we learned today, so it will be an interesting exercise to do so. So this is optional, of course, for those of you who want to leave us now. Just a couple of reminders. We have a keynote event with Town Hall Seattle tomorrow at 7:30 p.m. It's in person and also live streamed, although you have to get tickets for it to be able to see it. I am going to ask Liao to share the link for that. So thank you so much. And so that will be a conversation about the power of listening across contexts, but particularly at work. We've invited author Jimena Bengoechea, whose book Listen Like You Mean It is a very much a toolbox of how to implement listening and how to listen well across contexts. So we invite you all to that event, and we'd love to see you there in person, or you can watch it at the convenience at your home. It will be live streamed. We want to thank all of our speakers. Their insights inspired me, and I have a lot that I'll implement from today's conversation to my own work, and I have a lot to think about whenever I see information, but also types of communication about public health and our situation at the moment as well. They were an inspiration. So thank you to all of you. So if you want to say goodbye now, please, you feel free to leave. But those of you who stay in the room for another minute, we're going to break you out and pair you in groups of 2 or 3, just to give you a chance to talk with others about your own, what you're going to pick to reflect. And we just shared in the chat. Please open the document there before going into it to see the reflection questions. But that's totally optional. Again, thank you for this chance to learn with you. I've learned a lot. I hope you did as well.
Thank you everyone for joining, and thank you again for helping put together such a fantastic event. I've really learned a lot as well, and feel really inspired going forward. Can't wait for tomorrow. I'll be there in person, and right, it's right next door to your centrally located apartment. So hopefully we'll see many of you IRL for the first time in a while tomorrow night.
And in the next 60 seconds or so, if you're in this session, you're going to get an invitation for a breakout room. Feel free to join and take the next 10 minutes discussing the questions we shared with you, with those who are in your breakout room. Thank you again for a great session and joining us today.